Good evening, Oral Gibbs, and welcome to Speaking of Everything. And with me this evening, I have Dr. Mercuur. How are you doing this evening, Doctor?
I'm doing fine. Thank you very much for inviting me.
And thank you for accepting the invitation. Now, you're a general practitioner in St. Maarten?
Correct. Since about 95, I am established as a general practitioner.
Okay. And where are you originally from?
I was born in Curacao good amount of years ago. And after that, when I was 8, my parents immigrated to Holland. And from Holland, I moved to Suriname when I was 10. When I was 20, I moved back to Holland, did my medical studies, worked there for a few years. And then via Aruba and Curacao, I ended up in Sint Maarten.
But your English doesn't sound like someone from Curacao.
I'm a bit mixed up. I'm a product of the Caribbean.
You speak
a little bit of
that?
it. Siguro, papi miento tambe. Pero estilo Arubiano. So I'm mixed up of everything.
Oh, okay.
So that's where I feel at home in St. Maarten.
That's good. So you decided from a very young age you wanted to be a doctor?
No, actually not. I finally decided to be a doctor when I figured out that I was living in Holland and I had the opportunity to get education, which is a very affordable tertiary education in Holland. And I always knew I would not stay the rest of my life in Holland, so I chose something that was transferable to any other country.
Why is that? Why you felt like that, not staying in Holland for the rest of your life?
Maybe the climate.
Oh, okay.
Yeah, I like the climate better. So anyway, so I decided to study something that if I go somewhere else in the world, I can make a living.
Oh, okay.
Medicine is universal. So that's why I became a doctor.
So no regret there at all?
Nope, not at all. Not at all.
So how you found out about St. Maarten?
I was in Curacao, and I didn't have a steady job.
As a doctor?
Yes, as a doctor. I was replacing other doctors.
Oh, okay.
And then I wanted to get a steady job, and then I applied to the St. Maarten Medical Center, and I worked there for 2 years. And after that, I went to Stasia, where I worked for 6 months. And then after Hurricane Louis, I decided to open my own practice.
So you worked as an emergency room doctor
Correct,
also?
from 93 to 95.
That's a tough job, right?
Yes, it is. It's you have to do everything. You have to know a little bit of everything, and you have to be awake all the time. But that's like 20 years ago now.
Yeah.
It even got more complicated.
So as a medical doctor, you're quite unique compared to some of the other doctors in that you're doing a lot of other things.
Well, quite a few of us have something that they like and they do more than others. One colleague of mine does more gynecology, more dermatology, and one does aviation medicine.
Aviation medicine?
Yes, the Dr. The Cat from the airport.
Oh, okay.
Yeah. So we all tend to do something else besides the general practitioner. I guess it also comes with the size of the island. There are some smaller tasks that it's not big enough yet for one particular person doing only that. So you end up as a GP. One GP does that on the side, and the other one does that on the side. If you're living in the city of Amsterdam, you got one guy just for that, one guy just for that, and as a GP, you just do your GP box.
Oh, more specialized.
Exactly, but St. Maarten is relatively small. I mean, I used to work in Stasia. I made X-rays. Yeah, I never make X-rays in my life except for when I worked in Stasia.
Yeah.
I never. Yeah, so it depends on the society that you're in.
But don't you think it helps, makes you a better doctor in a way?
It's definitely more variation. Yes, I do. Yes, I like to have more variation. At the same time, you get more responsibility because you're in charge of more stuff. But I do like it to have more variation. Yeah, definitely.
Because I know that when there's an incident, when there's a crime scene, most of the times we'll read in the paper that you pronounce the person dead.
Correct, yes. I took over where Dr. Gomes left off after Hurricane Louis. He was very busy with rescue missions, and he said, Mike, listen, can you do this stuff for me because I'm really busy? And so he introduced me to the police and the prison, and from that moment on, I've been assisting the police and with their medical needs.
Right. And you're also a prison doctor also?
Correct. Yes. For probably 15 years now, I'm the prison doctor as well.
That's a little dangerous, right?
Well, yes. Things can happen. Things did happen. So you have to be aware of it. But yeah, driving in the city is dangerous too. Yeah. So yeah, but things can happen. Yes.
And so when you go to see a prisoner at the prison, is there always a guard there to make sure he's controlled? So that
yes. There is a medical department.
Oh, okay.
And within the medical department, there's always guards to make sure that the prisoner behaves the way he's supposed to behave.
It's amazing. When I was a little boy, the prison used to be on Back Street where the Parliament building is right now.
Yes.
And we used to pass by at night and speak to the prisoners from in the street. It's amazing how it has changed today.
Well, actually, when the substation was at Simpson Bay, there was also some stuff going on between the streets.
Exactly.
But yeah, I just missed that piece. When I came here in '93, I think the new prison is probably from 1991 in Point Blanche.
Yeah. So you like St. Maarten?
Yes, I love St. Maarten. I've lived a few countries, but never as long as here. And whenever I fly back over Juliana Airport and look at Maho, I'm feeling I'm coming home. Yeah. So I guess that comes over time. And my two smallest kids are born and raised in St. Maarten. Okay. So yes, I'm at least half a St. Maartener by now, I guess, give and take.
There is a family here.
Yes.
And so being a medical practitioner, you see general patients.
Yes. The majority of my time, I have normal patients like every other general practitioner. Yes.
And how's it been over the years? No, I remember back in the 80s, early 90s, when the world first learned of AIDS. There was such a fair amount of people, and I had Dr. Aylan, who was at the time a medical doctor in St. Maarten. And he was saying a lot of people were making a lot of fuss over this disease when there were other diseases that were killing more people annually than that one. At that time, people were like, he's talking crap. But you look at it today, he made a lot of sense then, right?
On a global scale, the most prevalent disease is malaria.
Yeah.
That kills most people suffer. But we're in this little western corner of the world where we look at what happens in the West. But on a global scale, malaria is disease number one, but we don't have it. So it depends what your perspective is. So if Dr. Aylan says there were other diseases that had more effect, he was right. But then again, he probably worked in third world countries where he's seen a lot of malaria patients and a lot of other things that we don't see.
So you think sometimes we in the media kind of hype it up too and scare the people?
You have to sell.
I mean, I look at Zika right now. That's mosquito-borne illness, and I wonder if the media is really overblowing it or not. You know, I don't know.
Well, I guess one of the problems is that there is not enough evidence yet on everything about Zika that we suspect. So as long as that situation persists, there's an uncertainty. Like in the United States, the advisory for women about 3 weeks ago was that if you have been in a country where there is Zika and you got Zika, you have to be tested. And when they found out that a lot of people apparently acquire Zika without knowing, they changed the advisory. Well, if you have been in a country where there is Zika, test yourself anyway if you're pregnant. So it keeps changing all the time. And I guess, for one thing, this uncertainty creates anxiety with patients and also with us, because we don't know what to expect and what not to expect. The same thing happened with chikungunya until it passed, and that was it.
There was the other one by mosquito, I think it's called dengue, something like that.
Yes, dengue was the one before chikungunya, and then came chikungunya, and then came Zika. But Zika is the one that apparently is suspected of having a severe effect, because if you can imagine, if babies get born with birth defects that are not lethal, but that makes them live another 30 years. That's 30 years of difficulty and hardship for the parents, difficulty and hardship for the child, tremendous cost for society. So it's really, really scary.
Is it true that if someone is infected with a mosquito that carry the dengue and you get bitten for a second time, then it's even more dangerous?
Dengue supposedly have 4 or 5 subtypes.
Oh, okay.
So there's dengue 1, dengue 2, dengue 3, dengue 4, and dengue 5. And there is a pattern that if you have been infected with one, you are resistant to that particular one. So if dengue 1 bites you, you get sick and you get over it, dengue 1 will never make you sick again. So if a mosquito passes by with dengue 1, you laugh at it.
Oh.
But if a mosquito passes by with dengue 3, right, your immune reaction seems to be much more massive. And so with each repeated dengue infection, if it's a different one, you could get sicker.
Oh, okay.
I have one patient, I sent him to the lab one time and he came back with 4 and he was
Wow.
pretty fine. Yeah, I'm like, whoa, dengue 1, 2, 3, 4.
And still survive?
Yeah, he was okay. But some people get very sick. A good friend of mine, I think she got 3 times dengue, at least that she remembers, and the 3rd time she was in a coma and she was in a hospital for 3 weeks.
Oh, because I've heard people die also.
Yes, yes. Dengue is, I think, of the 3, chikungunya, dengue, and Zika, dengue is the one that is probably most lethal, that will have bigger chance to die from. Where chikungunya, you get a lot of pain, and you might get a lot of joint pain for the rest of your life if you really have bad luck, but you don't die of it unless you're already in poor health. And Zika, it doesn't seem to have people die of it, except for people who get a very rare neurologic disorder are at risk, but that's very rare.
Okay. In your practice here in the island, are you seeing like more obese patients or more obese youngsters?
Yes, correct. It's a global trend, and St. Maarten is no different. China has the same problem. Even poor countries like India have a sub-segment of the population that becomes obese. On the long term, the lifestyle associated diseases will be the majority of the diseases that we'll be encountering.
So you think that we're going to have to probably do some campaigns in Maarten trying to get people to...
Yes, definitely. I think about 5 to 6, maybe 7 years ago, there was a How Healthy is St. Maarten survey, and I think there's going to be a new one. As a result of that survey, it showed that St. Maarten has a relatively high level of obesity compared to the other Caribbean countries. And out of that survey came a movement that existed for about 1 or 2 years about living healthy, etc., etc. But it died a slow death. But yes, I think personally it should start at kids level. I think there should be gym every day in school, and I think the school should start with gym, and that should include the teacher, because it's a lot more difficult to change a 30-year-old than to instill it in a 5-year-old. It's so I think personally there should be gym every day. The school start with gym, and then you get an apple, and then we go and study.
What about diabetes? Are you seeing a lot of
Yes,
diabetes?
Obesity increase the risk of diabetes, increase the risk of high cholesterol, increase the risk of high blood pressure. So as with the increase in weight, we also see an increase in diabetes, definitely.
And I noticed too, there's also this increase in blood pressure, and that's really, really
Yes, and the point is, if the diabetes increase, the blood pressure increase, at a given moment people enter dialysis, and it costs $100,000 a year.
100,000
yes.
per patient?
Yes. And now, when I came to St. Maarten, maybe there were 10 patients. Now there must be 60. They have 3 shifts, 5 days, 6 days a week. So they must be spending gazillions on dialysis. And most of the dialysis patients nowadays are patients who have not so good compliance with the diabetes and or the high blood pressure, and end up with kidney damage.
I'm so surprised because, growing up here in St. Maarten, we very rarely heard of people having to, in fact, they didn't have any dialysis machines at the time. And now there's so many.
Yes. When I started medical practice 25 years ago, you had to have bad luck that you had a kidney disease and end up dialysis. Nowadays, you get dialysis because you messed up your sugar, you messed up your blood pressure, you messed up your cholesterol, and you end up blowing your kidney, and now you're on dialysis. So instead of being a disease, it becomes a preventable disease.
So it is preventable.
Oh yes, oh yes, but you need to do something about it.
And that is like change your lifestyle, diet,
Correct.
this kind of thing.
Yes, but it seems to be extremely difficult. I read a study about 5 years ago in the United Kingdom where they took 3 groups of patients. They took one set of patients and tell them, okay, this is what you have to do because this goes wrong. They took another set of patients and told them that for a week. And the third set of patients, they give them a personal trainer and they keep on their case for 3 months. The only one that changed was the last one. Problem is, it's quite expensive.
Yeah.
Because the effort of manpower you have to put to reach that goal,
Yeah.
for that was a lot. So it's not an easy problem to tackle. And the only time the obesity in the States, the rate of the obesity declined was between 2008 and 2010, and I think it's because of the economic crisis.
When people don't have that much money, they tend.
That might be the answer.
Do you see anything else in someone that kind of surprises you or is alarming when it comes to health?
Yes. When it comes to health, yes. Mental health of the younger generation.
That one is surprising. It's really surprising.
Yes. There's a lot of. As I'm the police, the prison. I work in a prison as well. I see an increasing amount of very juvenile delinquency,
Yeah.
and our educational system and our system of upbringing seems to fail, leading to having kids that are non-productive, not happy, and tend to end up in the criminal circuit. And that is something, well, I come across it as a prison doctor,
Yeah.
not as much as in my general medical practice.
So I was surprised because I was speaking to someone from the Mental Health Foundation a few years ago, and the numbers of young people with mental health problems is alarming for an island this size.
It's, well, one of the contributing factors could probably be drug use.
Yeah, that's what they're saying.
Yes, that is. I also happen to have a relation with the Mental Health Foundation. I'm usually called in when somebody might be declared insane. And so I happen to know of these cases, and quite often with the younger ones, there's a drug abuse.
Is it difficult to declare someone insane?
Not sometimes, but most of the time it's clear. You basically have to meet 2 criteria. One criteria is that you're mentally ill, and the second criteria is that you have to be a danger to yourself and your surrounding. So if I walk over the street and I say I'm Jesus, I'm okay. And at the moment I walk over the street and I say I'm Jesus, and that's why I shoot you, then I'm not okay.
Oh, okay.
And I'm not Jesus.
Yeah. And so in your work, I mean, it's amazing. When you show up on the crime scene, sometimes you see teenagers that are shot and killed, right?
Yes, young people.
We're seeing that more these days.
Yes. That's. I did. For example, today I had to take DNA samples at the police station, and 2 of them were maybe 20, and 2 of them were minors. That is like, yeah, and I had to take their DNA sample. So yeah, it's, and yes, they end up on each side. They end up as victims of a crime and as perpetrators of the crime. So it's definitely not moving in the right direction at the moment.
I guess, and for doctors like you that work with the police and so forth, I'm sure that when you arrive at the scene, sometimes family members are there and it's quite chaotic.
Yes, it's always it's never pleasant. It's work, and it has to be done, and it's tragic when somebody's life get wasted. But it happens, and but it's always tragic.
And the thing is, once they cannot remove the body until a doctor like yourself arrive to pronounce the.
If there's a crime scene,
Yeah.
There are two important things. First of all, the scene has to be secured by the forensic department. They have to go look for all traces, and legally, formally, somebody has to be declared dead.
And only a medical doctor can do that.
Correct. I think if the head is separated, then a police officer can do it too.
Oh.
Yes. And I actually looked into the law from 1919 regarding burials, and it says somewhere that somebody else can do it too if the one fail and the other fail. But I have to look up the detail. But it's an old law.
But at least if the head is gone, then definitely
Yes, if the head is gone, I think a police officer is entitled to declare somebody dead. And he has to make, I guess, a process verbal.
Okay. Do they make any jokes calling you Dr. Death, anything like that?
Actually, that I found out my nickname is Dr. Death, but c'est la vie, I also do life.
I always used to hear about, Dr. Kovokian, he was a very famous American doctor.
Yes.
He was quite a nice guy, but he got this name because of what he was doing,
He was, I think, doing it out of compassion for people
Right.
who didn't have an opportunity to end their life and were suffering.
Euthanasia.
Yes, but okay, of course there could be people on the other side of the fence saying that it's up to God. I respect both opinions.
Yeah.
But I tend to think that he did it as out of compassion of those people that were suffering.
So, Doctor, we were speaking during the break, and you was telling me that, in fact, on the ABC Island, no, on the Best Islands, Sabre,
Right.
Statia, and Bonaire, euthanasia is
Correct.
okay.
Yes, euthanasia is the best island.
Yeah.
In that respect, fall under Dutch law, and two terminations are legal. That's abortion and euthanasia.
And in Sint Maarten, it's not legal.
Correct. Yes. And an abortion was. There was a court case, I think, about 2 years ago about abortion,
Yeah.
whereby a lady, as I'm not mistaken, from Santo Domingo got sentenced in absentia because they let her go, and she got sentenced to, I think, 1 year in absentia for taking some pills. I thought it was Cetotec to terminate her pregnancy. So not only is it against the law, but it's also being prosecuted lately.
All right. So anything else you do in your general practice? Because you're one of the few doctors that do so many different things.
Well, yes. As I said before, I assist the Mental Health Foundation. That is from the time I used to be a police doctor. When the Mental Health Institute was the police station. I assist in the harbor when there are deaths coming into the harbor. I'm the prison doctor. I do the forensic for the police, but most of the time I'm just a doctor
Right.
like any other family doctor. And I'm also member of the Health Advisory Board for about 2.5 years now.
But you're not like a regular normal doctor, because most doctors don't do all the work you do.
I am a workaholic, I guess, and I'm a little bit ADHD maybe, maybe a little bit hyperactive.
But at least, and where's your practice in Sint Maarten?
My practice is opposite the police station. It's just pretty convenient located for me. If I need a speedy ride, I'm right around the corner. Actually, the practice started there because I started my practice in '95 after Hurricane Lewis, and I had no job and I had no money, and I figured out, okay, where's the best place to start a practice that's next to the pharmacy? So I figured I'd better be next to Central Drugstore, and the police station just happened to be there.
You're centrally located. And that used to be the first drugstore in Sint Maarten.
Correct, yes. So I figured out I'm just gonna hug them, and then the patients will find you.
Yeah. Well, I want to thank you for coming in and being my guest and speaking about everything.
It's been my pleasure.
We like for people to know doctors like you because we read all the time about you. So now they know who you are.
Thank you very much.
Well, again, thank you, Dr. Mercuur, and again, much success.
Thank you.
That's it for now. We'll see you next time right here on Speaking of Everything. Until then, take care. Bye.